Assalamu alaikum and good morning, and welcome you all guys in the lecture of the series of the epidemiology subject. In the today lecture of the epidemiology, we will learn the prevention or the preventive measures. The first type of the preventive measures is called the controlling. Okay, control, or you can say controlling. Let's to clear the concept about the control or the controlling measures. The controlling measures or the control is the measures or is the strategies or it is a intervention to reduce the number and the frequencies of a specific disease in a specific population in a defined geographical area. The first one, it is to reduce, it is a measures, or you can say it is a strategies or intervention to reduce the disease. What's the disease frequency, numbers in a specific population in a defined geographical area. Okay, for example, if you decrease the number of the malaria in a specific population or in a specific community in a specific geographical area, that is called the controlling, to reduce the number and the frequencies of a specific disease. Now, how you can reduce the disease? Okay, reduce the disease. These are the four methods. First of all, you can reduce the incidence of a specific disease. If you decrease the number of the new cases of a specific disease in a specific geographical area, that's called the this is all the one method which you are controlling the number and the frequencies of a specific disease by reducing the incidence of the disease, means the decreasing the number of the new cases of the disease. The second one, you are reducing the prevalence. The prevalence is the total number of the new cases, or you can say the burden of the disease, or you can say the proportion or the percentage of the disease in a specific population or in a specific population and in a defined geographical area, that is called the prevalence. When you decrease the burden of the disease or the prevalence in a specific population, is the reduction of the disease. This is the second method of the controlling of the disease. The third one, decrease the morbidity of the disease. Morbidity disease. It means decrease the number of the diseases. Decrease the number of the diseases in a specific population, in a specific geographical area. This is another third method you can control the disease or reduce the number of the disease. And the fourth one is the decrease the mortality of the disease. Means you are decreasing the death rates, the number of the death rates which is causing by a specific disease in a specific geographical area. This is the another fourth method by which you can reduce the disease outcome. This is another fourth method of the controlling measures. So how much the number and the frequencies should be decreased or reduced, then you can say it is a control. It is means if you decrease the frequency or the numbers of a disease at the local level, which is acceptable. It means if any disease which is every month is adding the 1000 to 2000 number of the cases in a specific population, in a specific geographical area, when you reduce that number from the 1000 to the 2000 at the level of the 10 or 20, it means it is a control. It has been controlled because that number, the 5 or 10, is the acceptable according to that local geographical area, okay, which is acceptable in a geographical area. Okay, and how you control these the numbers. You have been control the number by the deliberate controlling, okay, measures or efforts, or maybe due to an intervention which is applied by a public health specialist, or by a policy maker, or by an epidemiologist. So these controlling measures, this is deliberate efforts which has been done by a public health specialist, or by the epidemiologist, or by any researcher. Due to these intervention or the efforts, the number of these particular disease has been decreased at that level which is acceptable and that local geographical area. Okay, the another methods which is by applying of these deliberate efforts of the controlling measures or interventions, how it will be remain to control if you will keep it continue. Okay, if you will continue this intervention or the controlling measures in a specific population and a defined specific population in a defined geographical area, so what it will be? The reduction of the disease frequencies or the numbers will be maintained at the reduction level. Okay, if any preventive measure which is you have been applied on a specific population, on the controlling of the specific disease, which is control the number and the frequencies of the specific disease and that local geographical area, so you should continue that preventive measure, which is a very increase the great improvement in the reduction of the disease, and that the number of the disease or the number of the disease or the frequency of the disease, you should continue to that efforts, or you should continue that intervention or strategies in the futures. Okay, so what is the controlling? The controlling is a maybe or may not be a set target by the WHO. Okay, it is not the by a it is not a target or the set target which has been introduced by the WHO. If the any preventive measure or intervention which is very effective and which is very effective in the reduction of the particular disease according to your own intervention, according to your own resources and the geographical area, this is acceptable by the local level. It is not a need of the set target or set guideline by the WHO. Okay, I hope this is the concept of the controlling or the controlling measures. It is a clear your concept about the control and controlling measures, to how you can reduce the number and the frequencies of the disease. You can reduce the number and the frequencies by these four methods. Okay, you can reduce the incidence of the diseases or the number of the new cases. You can reduce the number or the frequencies of the disease by the controlling measure and the prevalence level, at the morbidity level, and you can also reduce the death rates which has been happening by the particular type of the disease. Okay, and the last, I request you all to watch my video lecture properly. It will enhance your knowledge and the grip on the epidemiology subject. And the last, I request you to press the bell icon. By pressing the bell icon, you will get my new lecture as soon as I upload on my YouTube channel. Thank you so much. Take care of yourself.